Hey everybody, Dr. Dave Marquis here again, and I had 7 things that I wanted to share with you today. I've been thinking about all the different emotions that I'm experiencing and that I'm hearing from different patients as I talk with them on the phone, and some of those that are still coming through. And it made me think about this movie when I was a kid. It was called It's a Mad, 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 Mad World. And it was a comedy, and it was about a group of individuals that were told that they had to get cross-country by a certain amount of time, and they were going to reap a huge reward. And the things that these people did to each other and against others to acquire that prize was the humor of the movie at the time, because you knew that, okay, this wasn't real, but it was just silly. But I feel like we're living in that right now. I see the response of fear in people's eyes and their manner of speech, and I'm hoping that we collectively as humanity can rise above that and just calm down, take a step back, and realize that we're better than that. We don't have to panic, and that we each need to value one another's life and feelings and emotions and find ways to help one another during this time where everyone literally is struggling and everybody has a story. The different things that I personally have gone through in the last year in preparation of some of the move that I put my business through and some things with family. It's ironic, the timing, and I hear that story from so many different people that I'm just like, okay, everybody has their story right now. And we're all stressed because of the environment and finances and health and all these worries. So I just wanted to put that out there so that the rest of what I'm going to say has a little bit of context, because my personal belief system and what I know in my heart of hearts is that we're going to be fine. I know that to be true. And I know that to the extent that we can keep that mindset, we're going to be helping our body and those around us with that positive energy. We're going to be releasing our own beta endorphins and allowing our brain to have adequate GABA and dopamine and serotonin. And when other people feel that energy from us, it's going to help to calm them. And collectively, we can start to generate a healing response in the midst of all this turmoil and worry about illness. So here's my 7 things. The first one is really just focusing on the things that you can do on a daily basis, personally and as a family, to keep clean. It's things that I would do anyways, but be a little more vigilant with it. So that step number 1 is basic hygiene. And you've heard this everywhere and you're seeing it everywhere, but it doesn't have to be a fear aspect. It's just, I'm going to wash my hands, I'm going to keep my nose clean, and I'm going to keep my oral hygiene clear. I'm also going to make sure that my GI tract is working appropriately. So using your probiotics regularly and making sure that you're not putting stuff in that is pro-inflammatory for your body. Staying away from sugar like you would do at any cold and flu season. Just basic hygiene. Number 2, immediately reduce your own known risk factors. If you've been struggling with weight, right now is a great time to start some fasting. Doing some intermittent fasting. There's a lot of other ways that I would generally approach weight, but the beautiful thing about fasting in an appropriate fashion is that it immediately lowers your inflammatory load. And to the extent that you can accomplish that, it's going to put you a leg up. Avoiding those things that we know for this particular virus that actually enhance the potential for binding of the virus. And so that would be like NSAIDs in the ibuprofen family. And I know that as you Google that or hear it in the media, you're going to get mixed reviews. But I'm just going by what I'm doing for myself and for my own family. And so this is not my medical advice to anyone. This is just me telling you what Dave Marquis is doing for himself and his family. And I've seen enough evidence that ibuprofen does damage to the gastrointestinal tract, and it also happens to work within these ACE receptors in an adverse way relative to this infection, that it makes sense to me to avoid it. Maintain as much of an immune neutral state as you possibly can. So fasting goes back into that one again. I've already stated that one, but the other things that you can do in that regard is to make sure that you're utilizing those micronutrients that I've talked about and not stimulate your immune system in an adverse way. I've had several questions on elderberry, and somebody just posed that to me again today. The only reason why I stated that elderberry wouldn't be appropriate for this particular infection is because it tends to be a Th1 stimulant, which can promote cytokines. Now, if you're not sick right now and you're not fighting the coronavirus and you've got zinc lozenges that have a little bit of elderberry in them, knock yourself out. It'll be fine. You just don't want to go gangbusters on the elderberry when you're fighting that particular infection. In the manner of trying to calm the immune system down, that's where I really love using the vitamin A, the C, the D, the E, the zinc, and the glutathione. And I've written about that and I've talked about that in the past, so I won't belabor that, but that's the group that I'd encourage everyone to have on hand. Making sure that you're getting adequate sleep. Can't overemphasize the importance of sleep for the restorative nature of the body and our immune system. So taking time to get to bed early so that you have the opportune hours to use the natural circadian rhythm of sundown to sun up, work on that. Make sure that you're getting adequate sleep. Exercise. Exercise also helps to boost our immune system, and one of my favorites, and actually for this particular concern as well, is exercise that increases your vascular perfusion. Here in the office I have a wonderful device called the VASPER, and it stands for vascular perfusion. And we use oxygen-enriched exercise with that. And it actually provides compression of the large muscle groups so that you can increase your release of brain-derived neurotrophic factor and increase your O2 perfusion by upwards of 300% with each session. It's a fantastic therapy. If you don't have access to something like that, get out and do what you love to do. But if you happen to be here in the 5 cities, please come use it. It's a great machine. Managing your stress relative to everything that I started this conversation with. Here in the office we do a lot of heart rate variability work, which is the understanding of what your autonomic nervous system is doing. Most people today are living in a sympathetically driven state. That's the fight-flight state. That is not a healthy state to live in. It's okay if you have somebody pointing a gun at you or a lion, tiger, or bear chasing you. That's when sympathetic drive is appropriate. But to live there continuously causes high cortisol, suppresses your immune system, makes your gut lining poor. It's just not a place that you want to be. So finding that happy balance between sympathetics and your parasympathetics really is this work of heart rate variability. If you haven't looked into that, I would encourage you to. If you need a little bit of coaching, we're happy to help provide you with that. The last category there is, and this is category 7, if you actually do acquire an infection, and even if it is the infection that we're dealing with COVID, there's a lot of things that I encourage people to do in regards to last line of defense, so to speak. And this is where using the ozone therapy that I talked exclusively about in another video. Ozone therapy is fantastic both as a preventative measure and as a therapeutic measure in an event. Using hydrogen peroxide, and there's blended forms of that individuals can nebulize. I've got several doctors up and down the coast that have been using that with patients with active infections. Even individuals where they've started to get some of the lung symptoms and seen great turnarounds by utilizing the C, the glutathione, and some of the nebulized hydrogen peroxide. Use caution with that one, and please consult your physician in that regard, or give our office a call, and I'd be happy to tell you what I do for myself. Curcumin has also shown to be a great quencher for cytokine storms. So if you have curcumin on hand, that's something you can use preventatively and in the event of that. And then you've probably read many of the articles, and it's actually getting pushed through the FDA right now, using the hydroxychloroquine. Now that's not chloroquine. It's not the straight drug. This is a modified version of that, and not over the counter, but the prescription version would be the Plaquenil family, and that actually needs very, very low dose. So if you have a physician that's willing to prescribe that for you, you need very little of that, and it really does help with the cytokine storm. It also helps to give access to some of these other things like zinc to get in and actually dismantle the wall or the shield around the virus. Much like vitamin D does. So vitamin D, vitamin C, zinc, they are all virus shield busters. And that's why those are so important to have on hand. The reason why they've been suggesting using the Z-Pak in addition to the hydroxychloroquine is because it takes care of the secondary bacterial infection that is opportunistic. It's not touching the virus, of course, but in combination, as a last stage resort, that would be something that people can use. So those are the things that I wanted to share with you today, and over the course of next week, I think I'm going to break each of these up and talk a little bit more to you about them, but I wanted to give you a summary and try to not belabor the point too much. I know that we're going to be fine. I know that we're going through a trying time right now, and I sympathize and empathize with everyone who is being impacted, both financially and health-wise, and know that my prayers and my family's prayers are going out to each of you and to the world collectively, that we can work together and love one another and just come out on the other side of this as better people in humanity. So thanks for your time and listening, and I look forward to talking to you some more.